think we are live.
Okay.
Okay, let me just double check. At least we're live. Should be live on YouTube.
Okay. I don't think I'm live on Instagram, but
Did you
yeah,
hit
that
your
might
thing
be
on your
some.
side yet?
What was that?
Did you hit your go live on your stream part?
I don't have an option to.
Hmm.
This is what happened last week too.
Okay.
Or, when we did this last.
Really?
Yeah.
Hmm. All right. Well, should we
Well,
proceed?
yeah.
Okay.
Yeah. I think we should. All
Sorry,
right.
Instagram. We'll never know what could have been.
Well, YouTube. We have some people hopping on.
Yep. Greetings, everyone.
Perfect.
I'm
All
Dr. Brandon
right.
Vanderwell at Aviva, actually.
Ah,
Yeah, I got the sign up.
looking
Um,
good.
bariatric surgeon and Dr. Tan.
Dr. Tan. Hi. All right. Cool. Well, I was thinking this week we could talk a little bit about, just picking the right procedure for you. You just came back from ASMBS, and so we could also go into what's new, upcoming. Just I think it's a good kind of topic to just kind of jump into
All
for
the
the
stuff. All the
yeah.
stuff. Yeah. I kind of reformatted one of my talks
Uh-huh.
that I could actually potentially share about kind of just having the about this topic, which is like, and it just kind of gives some framework to
Yeah.
how do we think about different tools for weight loss.
Mhm.
So let's see if I can switch it. Oh,
I think that'd be great.
let's see here. Um, Share.
So I think that's probably one of the more common questions I get is just, well, how do I go about picking? Do I do
Yeah.
medications first? Do I do surgery first? Or is there a right way to go about things? And that's coming from patients, it's coming from other providers. It's a big question.
Yeah. Can you see me okay?
I can see your slides. Yeah.
Perfect. Great. So I like to think of yeah, like weight loss tools. This is my framework for why do we even consider like weight loss tools or tools to help to, to our metabolic conditions. And I like to think of like the end and goal first, which is success. What does success look like? And I think what success looks like for me is having patients on the road of health. And what that means is they're driving in their car, which is their body, and their car is running great. It's feeling awesome. You're on the road. It's a beautiful drive. You are enjoying the drive and you're paying attention. You know where you're going. You're getting there in the time frame that you want to get. You're moving along on this road on the time frame that you want to get, and you're just having a great. That's what the good life is, and I think that's what most of us got into medicine to do. Is we want people to help people be on this road to be living wonderful lives as healthy they can be in their bodies. But this is what most of our patients feel like their journey is like right now. They're
Oh,
broken down on the side of the road and just like nothing's going right. They're out of control. It's all over the place. The car's not working well. There's the driving is suspect. Like everything's going wrong. So I took kind of the framework here is like, so there's hardware. So that's the parts of the car, right? There's the engine, there's the brakes, there's the power steering, there's the power brakes, there's the transmission. There's the software. The software really helps get the most out of the hardware and helps the hardware perform its best. So it keeps everything smooth. You have like lane assistance, keeps your car in your lane, automatic braking, adaptive cruise control. Very helpful pieces of software that really make the driving experience safer, more streamlined, easier. And then there's guardrails. So that's what these tools also do. They give some guardrails around some of the dangerous curves when it comes to healthy behaviors, particularly overeating. I think that's really important because if there are that's the biggest danger that we have with really big stomachs, I think, in the 21st century. So, and then there's the operator. That's another important piece of this journey, which is that if you're driving a car, you number one need to know how to drive. So you need to kind of know what you need to do to function this to run this thing well, how to maintain it well. You also have to know where you're going. You also have to be paying attention when you're driving. And all of these things are critical for getting you to that successful having a great living a great life and taking care of your car of your body. These tools are not a chauffeur, a chauffeur. They're not, it's not full self driving. None of these things are going to, automatically have you a perfect car that is super luxury and someone else driving it. That is not what they are. But it is a great way to a great way to I think frame this. And also here's the risks that are associated with this. So if you change your car, you do something to it, you could potentially crash. If you are taking a certain, you have certain things, and you have to maintain your car as well. So, all right. Does that sort of make sense? If there's any
Yeah.
comments, I can't actually see anything on the thing now that I'm in presentation mode. So, if you any questions come up, I'm sorry,
Okay.
YouTube. I'll get to them in a second. So what's our tools that we have? So weight loss, the timeless trope we get is diet and eat less, exercise more, diet and exercise. And what really this is, the lever that we're pulling on here in the tools categories is the operator. We're just telling the operator, get your crap together. Like you just need to do better. And you're not really just saying like, you're not really you're attempting to upgrade them by saying, hey, here's how you drive the car, give them some lessons, stuff like that. The problem is that your car, if your car's really not made for, and I would argue our cars are not made for the 21st century. They're made for a lot, periods of hardship and scarcity. And that's just not necessary. Most of us live in comfort and, relative abundance. And so it just makes it much, much more challenging when you try to do this. The nice thing is there's not really much risks to actually trying to do this. There's not really much maintenance that takes, with trying to do this. It's just very hard to do and be successful with. And honestly, when you are trying to lose weight, and I think everyone's experience is trying to lose weight, is that it actually gets harder. Like the software of your car, it makes it harder to drive because you're very hungry and you're like, I just want to go find some food and eat some food. So GLP-1s. So this is the next tool that's I think out there in the world that's very relevant. It's been very cool to see these things come onto the market and just to see what sort of success they have. And what they really do is they don't really work on the hardware. So they don't make any changes to your stomach. They don't make any changes to your intestine, to your mucosa of your linings. They don't change any of your organs. What they do is they do act on the software part, so the chemistry, the hormones, and unfortunately, or fortunately, they are temporary. And so when you're taking these, you do notice a difference, um, a pretty significant difference. You're less hungry, you're feeling more satisfied, you're okay with smaller amounts of food. And then it also gives you a little bit of a little bit of a guardrail upgrade in the sense of it slows down the emptying of your stomach, so your stomach feels full more frequently because it is. And so you do have a little bit of a guardrail for overeating, but it's not a very robust guardrail. That is not a guardrail that is reliably used, that is reliably experienced and super protective. And it's kind of an operator upgrade because you do feel less hungry, right? So that makes you helps you with maybe getting less distracted. But it also is seems to be a benefit for the dopamine pathways of vices, particularly when it comes to overeating. Not necessarily overeating, but like coping, like from a coping standpoint, and like alcohol is the biggest benefit. I think that people have less alcohol inclination. So I think there's definitely some benefit from an operator standpoint. The risks are really relatively low. But the maintenance, this is challenging to maintain. This is a very challenging maintenance pathway. And the hard thing is that it's temporary. And when you stop these medications, there hasn't been any sort of hardware change, and there hasn't really been any sort of permanent change in your body. You're just hoping that you've been able to get a good routine going, and you have a different framework of mind, and maybe you can just maintain the success that you have. In the real world, that's really challenging. What we see, these are some studies on semaglutide, and the second on the right is also tirzepatide. And you can see that you see some really good success in the first year and a half here, And then over time, after you stop the medication, it's really hard to maintain that success. And most people lose over half of the, go back to about, lose 2/3 of the progress that they made. So if you are in this group of people that has seen success with a GLP-1 and then really struggled to get off of it or had to get off of it for some reason and gain weight back, no, you're not alone. Like that's not unique. And then here's a real this is a clinical trial study that's industry sponsored. So this is and what we see in the studies, there's the industry sponsored studies that have really very robust data, like almost 18% total body weight loss for semaglutide is definitely the best study that we see that's published in real world. So when we look at when this is actually used in practice, we see a much not quite as good. So usually at 12 months, we're seeing close to 10% semaglutide, all comers, or less than 10%, 9-ish percent, 8% for semaglutide, and about 15% for tirzepatide. If you don't have diabetes, it does seem to be work a little bit better for both of these drugs. But if you are thinking that you are going to lose all of your excess weight and not struggle with obesity anymore when you started this medication, unfortunately, that's just not the reality for the majority of people. And we see this in our own practice too. Is that these are great drugs. They're really helping in a lot of ways. But if you aren't seeing like a cure of your obesity, quote unquote air quotes cure of your obesity, you're not alone. Like this is not a unique experience. That's actually the majority of people experience that, and the majority of people really struggle to keep that weight off once they stop. So the intragastric balloon, I'm not going to go into this too much. I think it's a cool tool, but people like you have to know like this is temporary. You only do it for about 6 months. It fills up space in your stomach, makes you feel more full, less hungry. Um, generally very safe. Its its side effects can be real. There's real side effects of nausea generally, but usually manageable. There's a certain rate that does come out, but generally people know what they're getting into here, and it's I'm just gonna have something that fills. I'm getting a temporary fill of the stomach, and I'm just trying to get my things together and get on track. And then once I'm there, I'm hoping to really have locked in some good behaviors to maintain that. The next tool we'll talk about is the endoscopic sleeve, the ESG, endoscopic sleeve gastroplasty. And this is where we start finally getting into some real hardware upgrades. Your stomach is a big bag and it wants to eat food. And when you use this device, you're able to suture from the inside. You go down through the mouth and then into the stomach from the inside. There's no incisions, nothing's completely removed. And you suture that stomach closed and crumple it down. And it makes your stomach smaller. And that is a real hardware upgrade. When you make the stomach smaller and you reduce the surface area of the stomach cells that are contacting food, that has a hormonal benefit. That's our software upgrade right there. Is this software upgrade quite as dramatic from a hormonal standpoint as a GLP-1? Arguably, probably not, because the GLP-1 is a very heavy-handed, just GLP-1 and maybe GIP, if tirzepatide impact. But the nice thing is that this really does help keep that stuff down, and it makes your stomach smaller, so it gives you maybe not quite as strong, but a more durable upgrade. It does provide definitely a real guardrail in the sense of your stomach is smaller, and so it's harder to eat more bigger portions of food. It's very helpful from an operator standpoint when you have a smaller stomach, and this is what we see is that you're like I know how to drive. I'm trying to pay attention. I'm trying to stay on the road here, but once the car is tuned up, I'm like, oh, I can totally do this. I still have to be paying attention. I still have to live with intention, but it really does help a lot, and it's very a good tool. This is kind of what it looks like. This is a demonstration of a model where we put some endoscopic sleeve sutures in there. You can see they're full thickness bites. And then when we suture them down, we cinch them down, you crumple the stomach up and you make it much, much smaller so that this stomach, which was usually used to be really big, is now much smaller, and which is very helpful. So the huge benefits of this procedure is that the risks of it are very low, especially in experienced hands. And the maintenance is also very low. This is a very low drama procedure. Most of the time when people, what's it going to be like in 2, 5 years, 10 years after having an endoscopic sleeve gastroplasty? It's very unlikely that you'll have some sort of issue that you'll have to deal with. So, success rate, I give this a 4 stars. It's not perfect. The weight loss we'll see is not the most, It's not as high as the surgeries, but it's a really good tool, and it does help a lot of people. So the laparoscopic sleeve. So this is a stronger upgrade to your hardware because you're removing a portion of that stomach and making it smaller. The software gets a bigger upgrade because you're removing a portion of the stomach. Guardrail is stronger as well because you're removing a portion of that stomach. It's very helpful to from an operator standpoint. The risks, especially in our hands and experienced hands, are very low. But it does require some maintenance. You got to have be paying attention. You got to make sure that you are taking care of it. Probably this is a real one where you want to make sure you're taking vitamins. But yeah, this is a really good tool. There's a reason that laparoscopic sleeves are one of the most common operations done in the United States and in the world is because it's very helpful. It's very helpful to have a smaller stomach, and it's very helpful from a weight loss standpoint. In our hands, it usually sees about 30% total body weight loss. The other tools are the malabsorptive, quote unquote malabsorptive procedures. So the gastric bypass, a SATI or a BPD. These are a major upgrade. I get this one an all caps upgrade, because you're not only making your stomach smaller, but you're also rearranging some small intestines so that you don't absorb food quite as well. And you have a major hormonal upgrade there too. This is like these surgeries, the LSG, but particularly the gastric bypass. This is the original GLP-1 receptor agonist surgery. This is where they got the idea that we should look after these drugs, is because that's what one of the major hormones that affects this pathway and success is it increase of GLP-1 on a on a on a hardware standpoint now that's backed up and more durable. So it gives a good guardrail for keeping your portion sizes down. It's very helpful from an operator standpoint. And this is what people say when they have these tools is that I know the goal of this whole journey is to eat healthy food in small portions and then find the right maintenance dose, right maintenance spot for my food and be able to stay there. And these tools are very helpful to keep people there. There is a short term and long term complication risk with these procedures that you just need to understand. It's not huge, and almost everyone that gets one of these surgeries doesn't regret them, but it's something that you need to weigh the cost of. And the maintenance of these though is real. Like you got to pay attention to them. You need to take your vitamins. And you need to understand what this tool is, and it's very effective. If you really struggle with your weight, this is a really, and you're like, I want to live on that path. These are the strongest tools, and it's just about figuring out which tool of these is going to be best for you for helping that. So all right, Dr. Tan, that was my presentation. Let's see, how do I stop sharing? There we go.
It's great.
So
Yeah. I love a good analogy.
yes, I maybe I pushed it too farther than it can reach sometimes. Or if you don't really know much about, if cars aren't really your thing, I don't think it's gonna really hit that well with you. But I think it's just helpful to know that um, all these things are a little different. All of them have their plus and minuses, and that's the thing about life is that life is a series of calculated risks. Like where you are right now in your health, you have risks associated with whatever path you're on right now. If
Yeah.
you choose to go like, hey, I'm really struggling with my weight, I'm struggling with diabetes, I'm struggling with hypertension, there's real risks on this pathway right now. You're like, I want to get off this pathway and I need to get over here. There are risks associated with that, but generally, based on which tool you choose, those risks are, that's a very, very good calculus in your favor.
Mm-hmm. Mm-hmm. Yeah. Yeah. And I think, you know, and I'm not a car person, but I think what's nice about like a more detailed analogy like this is that, you know, obesity as a disease is so complicated. There are so many things that factor into obesity. It's not just what you're eating, it is more complicated than that. And then all the different kind of ways that we hit at it or address it are different for each of these tools. And so they're different mechanisms of action. We're working on different things. And so it's nice to be able to kind of see all of that in one
Mm-hmm.
graph, I would say. Um, all right. Well, I would say, I guess, that's a nice overview of everything. Clinically, like when you see a patient, what's your approach for advising them? Like, okay, is a medication a better option, or
Yeah.
like,
No, it's a great question.
surgeries are options.
Everyone's a little bit different, and it depends on what their goals are, where they are right now, and what their goals are. If you have someone that is like a BMI just under 30, you know, not really a long history of obesity, just kind of really got off track a little bit, haven't struggled to get back on track, that is the most ideal person for getting the best success out of a GLP-1. Like
Mm-hmm.
that is the person that has the most amount of success chance of getting back on track to the weight that they want to be with a GLP-1. I see. If you are on the other end of that spectrum, if you are on like a high BMI, like, if you are 100 to 200 pounds overweight and have been there for a while, your chance of getting out of that with a GLP-1 is probably less than 1%. And you really need to consider a more serious surgery. And even then, I tell people, like, you should probably consider something more serious than an endoscopic sleeve, at least something like a laparoscopic sleeve, maybe gastric bypass or something like that. The there's a lot of different tools there, and there's a lot of different things that are going to be the right that are going to help you to make the right decision for you. When you're trying to choose between endoscopic sleeve and maybe one of the laparoscopic sleeves, my choice, what I tell people there is, if you're willing to do one of the laparoscopic sleeves, you should seriously consider that because they are really good tools. They're very safe in our hands, and they work very well, and they're very durable, and they are significantly better than the endoscopic sleeves from a result standpoint on average. But if that's not you, if you're like, man, I just don't, that just does not, that's not sitting well with me, really do the endoscopic sleeve. If you are really, your BMI is above 35 above for particularly, or even 30 above, like the endoscopic sleeve is really the best thing that's not surgery compared to, the surgeries. I think it is a lot better than the GLP-1s. I see it in our practice. I think together they're awesome. They are amazing together. But GLP-1 versus ESG, like the ESG loses more weight, number one. Its durability is way better. It's actually cost effectiveness is like at 2 years is like equivalent, if not better. So it really has a big leg. Like changing the hardware means a lot. It means a
Yeah.
lot to change the hardware and to have a smaller stomach.
Yeah.
So,
Yeah.
but the other thing that I think my calculus, and this is my last thing I'll say is, I generally try to have younger people, like people under the age of 40.
Mm.
I do worry a little bit about gastric bypasses in those patients just because um, they have so much of their life to live. Still they have still so many decades in front of them, and all these things are tools, and these tools, they can, over time they may not work as well, and in 20 years, if you're struggling with a bypass, which I do see unfortunately from time to time, your options are more limited about what you can do from a treatment standpoint. So the nice thing is the medications are really getting a lot better, and they work really well when you have a smaller stomach after surgery. But a laparoscopic sleeve is a really good tool. You generally need a good reason to not get a laparoscopic sleeve. So,
Yeah.
kind of
Yeah.
what do you kind of advise people about one thing versus another?
It all depends on your goals, like how much, and the goals more or less boil down to like how much weight you want to lose. Everyone has different goals as to why they're coming into surgery. I don't think you have to have a very specific idea of how much weight you want to lose, but ballpark, that's helpful for guiding that discussion. Because, if average weight loss that we're seeing with these medications is somewhere between maybe like 10 to 15%, if that's not even going to be like half of what you're hoping to lose, like I don't know if that's a great starting point. And so it's a matter of looking at what your specific goals are and then calibrating the strength of the tool to your goals. um, I think the other question I get a lot though is, well, is there any harm in just starting with the medications? That's a very typical approach that like we see in medicine, right? There's a ramp up approach. We go from the least invasive to the most invasive, and um, it's very normal. No one wants to have surgery if they don't need to have surgery, right? And so it's like, why don't we just start with the medications and try? And in some ways, like I don't think there's anything wrong with trying the medications first. It's not going to be harmful to you. It's not going to be dangerous to you. But I do sometimes think about like uh, with weight loss, so many of my patients yo-yo diet so much in their lives, and I think there is one momentum in terms of once you start losing weight, more weight loss can come with that. And then, there's momentum that we're building with that. And then there is also this potential that every time you're yo-yo dieting as well, that you're actually harming your metabolism and you're actually
Oh yeah.
like being a little bit worse off than where you were before. It's part of why people gain more weight sometimes when they rebound after weight loss. And so in some ways, if we're looking at these injections or medications as maybe something to try without any harm, I wouldn't say that it's no harm whatsoever. We want to be careful with it. If you're going to try the injections, it's best if you're doing it with a provider who can work with you. And if you're going to come off the injections at some point, you want to be able to do that safely as well. And so, like, no, there's no harm necessarily, but at the same time, if it's really not going to get you close to where your goals are realistically, in some ways it might not be doing as much good as we think either. And so it's a conversation. It's complicated. Sometimes I start folks on a medication and then we go to surgery and then we start you back on medications. Sometimes it really makes the most sense to just go to surgery first and do medications afterwards. Um, and so it's kind of variable. It really depends on each person, I would say. But
No, that's a great
yeah,
point.
yeah.
Because you're totally right. In medicine, if your BMI is above 45, particularly,
Hmm.
like your chance of making the progress that you need with the GLP-1 is, um, I mean, it's single digits
Yeah,
percentage point,
yeah.
maybe,
And
like
and
low
like
single digits.
yeah,
So
and there's
that's
so
I
much
would say from a medicine
psychology with
standpoint,
weight loss too.
that's not a when we tell people that they should that's a viable option, like that's not something we do in the rest of medicine, which is like if you have around a 5% chance of getting to the goal of this therapy, like, and there's other therapies that you should talk about, you should at least talk about them.
Yeah, yeah, yeah. And I think like with weight loss, it's like there is a psychological component to it as well. There's a mindset component to it as well. And if you're losing weight and you're not losing as much weight with a certain tool as you would have expected or was hoping for, that makes it really hard to kind of want to keep going sometimes.
Mhm.
And again, this is why we often see patients who have tried something and then they wait another couple years before they try something else again. Um, and I'll say, like with surgery, what we hear over and over again is everyone wishes that they had done this sooner.
Yeah.
And so it's like, why delay sometimes when it comes to doing surgery if we already know that that's going to be the best tool for you?
Yeah.
Um,
Yeah, it is. I would say, in my experience, it is a over 90%, 95% plus. People are
yeah,
like, I just wish would I would have done this sooner. And only about 10% of people long term who do a GLP-1 are like, oh my gosh, this has been the best thing that ever happened to me. I wish I would have done this sooner. And those are people
yeah,
that are taking the medication, got to where they want to, and cycled off.
yeah, yeah.
That's it's very hard. It's the minority. Like sub
Mm-hmm.
20% of people are able to get to achieve that. So
And then I think the notable exception, like medically as well, is diabetes. If you have a newer diagnosis of diabetes, there is time sensitivity in potentially reversing your diabetes if that is the goal with one of these surgeries. The longer you wait, the less likely you are to get remission or to be off all of your medications as you continue to like burn out your pancreas. And so that's a huge, I think, just like dogma thing that we need to change actually in medicine is
yeah,
is addressing diabetes with these surgeries. So
great
I
point.
guess we should actually probably, I mean, you talked about this already in terms of like how much weight loss you can actually expect with each of these options. Did we
I can
go over like
share.
the actual percentage numbers?
How about I share the data from our program?
Okay, perfect.
All right. So this is our program. Go into presentation mode here. The green is ESG, purple is LSG, blue is GLP-1s, and this is our preliminary data. We don't have all
Mm,
of our, all the breakdowns we want yet, but this does give us a loose framework of what we're looking at. So the majority of people at 12 months at 1 year is between 15 and 25% with an ESG. And LSG is 25 to 35%. Like that's where most people are. At 2 years, most patients are preserving those gains, if not seeing a little bit of increase actually with the LSG group, which is super cool. And at 3 years, we're still there. Like it's
Mm-hmm.
cool. Like this is the majority of people are still seeing good progress. You can see the tail end, the bottom end people for the ESG is like these people aren't doing as well. They're a little bit bummed. The LSG people, that tail is a little bit wider. There's people that aren't seeing as much success at 3 years, but it's pretty rare. And the top end people, like, this is awesome. Like there's some people really crushing it here. And how does this compare to our GLP ones? And this is our 1 year data. And unfortunately, this is like about what the national
Yeah.
average is, which is between like 8 and 14, 15% for GLP
Uh-huh.
ones at
Yeah.
1 year. And 2 year data is, even not even as good. Like that has
Mm-hmm.
really widened out. And this is the people that are like still seeing this for the medication. This isn't even considered the people that have dropped out and
Oh,
dropped.
wow.
Yeah.
Okay.
So there's still more to be done on this data processing, but it's gonna look something close to this. Yeah. So there'll be some nuances here, and this will be refined a little bit. But overall, yeah, and for like this is pretty consistent with what we see a lot of the ESG and the LSG data. This is a little bit better than we see nationally. We do get a little bit better. Um, we generally get a little bit better data than we see that's in published stuff. I think that's a factor of we have great patients that we really try to empower to see succeed. We have a great dietitian team that really goes. They do a really good job. We do, procedure wise, we take a lot of pride in what we do there too. But the GLP-1 stuff, I was actually pretty shocked that we didn't do better than the national average a little bit because I was like,
Mm.
we're very accustomed to significant weight loss. We kind of know what it's going to take to get people there, and but we've kind of been about the national average. I think this is a
Wow.
hardware thing. Like when you don't change the hardware, it's really tough to overcome a couple things there. And that's where, we see the hardware progression. The more of an aggressive hardware approach you take, the more likely, the more amount of people are to see to succeed. So,
This is the first time I'm seeing this data, and this is, the ESG and LSG. I feel like that's pretty what I would expect. But I'm shocked by again our GLP-1 data as well.
I thought it would be better than the national average. I mean, there's still some people doing
Yeah.
awesome. I mean, look at this top end.
That
You know,
that's what I was gonna point out. Yeah.
this
Yeah.
is this is these people are really happy. Like the
Right.
people up in here,
Right.
they're pleased with how things have gone
Right.
in their life in
Yeah.
the last couple of years.
Yeah.
But I think the takeaway for me here is that 75% of people in the ESG group, the green group here, are doing better than 75% of the people in the GLP-1 group.
Mhm. Yeah.
75% of the people in the laparoscopic sleeve group are doing better than 75% of the ESG group.
Yeah. Yeah.
Like the difference between these two, like the ESG and GLP-1 and an LSG, is vast. And also the difference between a GLP-1 and an ESG is actually very significant too on all comers. So there's still people doing awesome in all these groups. There's a lot of success in the top end, in the top quartile. But if you're talking like, what most people experience, it's there's these tools are different. They're different.
Yeah. And I think that's the tricky thing with, well, it's the tricky thing with actually all of these tools is that we all hear about the people who did very, very well. Oftentimes, like right now with these GLP-1s, we hear about that top
Yeah.
25% of
You're hearing
folks
you're hearing about
who
these
are
people.
who
Yeah.
are doing amazing. They've lost 100 pounds, and that's, I mean, that's amazing. That's life changing for them. But they are kind of the super responders to these things, um, and so that's
And the
it can be
the
very disappointing though for folks who are trying these injections and they're actually just kind of in the middle of the pack, which is where most folks fall.
mhm. And what's going to be tough is that when people come off of this, most of these, the sad part is that at least what the data shows that's published out there, we don't have our own personal data on this yet, but the people, when they stop the medication, it's really hard to maintain this. Most people will not maintain this.
Yeah,
Most
yeah, and so
people, the
yeah,
majority of these people will lose their gains,
yeah,
at least half
and
of them. Yeah.
I would say, yeah, that's interesting because this is all just people who have followed up with, like, continued to see us long term.
Yeah.
So, yeah, it's interesting.
Yep.
That
So
is that is very cool. Let's see, a chart. They say a picture, says 1,000 words. I think a chart shows even more sometimes.
yes, it does. Yeah. Especially if you're into that sort of thing.
Yeah, I know it's a pretty nerdy thing to say,
Yeah.
but
And I like box and whiskers too because I think it tells more of the story than just an average.
yeah.
You know.
Yeah.
So all right. Um, any other questions that came in, or we want stuff we wanted to address?
You know, I don't I don't think there are more questions, but I don't know if that's just me not being able to see them problem. But
Yeah. Cool. Well, Dr.
but I
Tan.
think that was a good discussion to kind of go over all your slides and kind of go over some of this data. It's really nice to see the visual, I think.
Yeah.
Yeah.
No, I think it's fascinating. It's gonna be really cool when it's all done and published. And there's and I can't wait to see more nuance too. Like, so if you do a procedure and you do a little bit of GLP-1, how does that affect your 3 year data versus not? And so um, I really believe we're living in the and era. It's not a procedure versus GLP-1 era. Like it is a procedure and GLP-1. Obesity, it's hard. Obesity fights dirty. We need to use as many tools as we can. So
Yeah. More tools, the better, for sure.
very good. Well, Dr. Tan, YouTube, it's been a pleasure. If you have any questions, reach out to us at avivamd.com. We all of the people on our team, we love helping people, change their lives and really see some great success. And you can be on that road with driving feeling good, driving a car. I just talked to a bunch of people yesterday. Um, I talked to like two or three people who had like picked up running and who had done half marathons already this year. And or just whatever it is that they're doing. People doing Zumba, people
Mm-hmm.
doing, just starting to really enjoy their life and feel, playing out, getting out there, playing with their kids in the summertime,
Yeah.
getting on the
Yeah.
kayak, getting on the paddleboard. Like it
Yeah.
is, there's so much of life that, I think obesity holds you back from. And it's time for, it's time to see what these tools might be able to offer for you for getting on that road, on that path.
Yeah.
So thank you, everybody. And yeah, hope you have a great day. Feel free to always reach out to us at avivamd.com. And thank you again.